Hi guys, I'm here. I'm with Rachel. Guess what? We are at the most beautiful campus on the world, of course, UNC. And I was talking to Rachel about beyond my expectations and basically what can be done for individuals with autism, kids with special needs as they get older. And she was saying that there's a lot of opportunities for ages, 4, 5, 6, younger, but once they reach that adolescent stage, there's more of a challenge. She has seen great strides with occupational therapy, physical therapy for kids with regards to communication and more engagement. So I want her to tell you a little bit more because, I don't want to just focus on my opinion. I want to hear from other people. So here we go. Thanks, Rachel.
All right, I'm going to go this way out of the sun. Well, so my experience is limited to mostly younger children. However, I've worked with children that are older who have various challenges, maybe not as extreme as some of the things that this facility could help with, but I've seen the way that occupational therapy can really help on a lot of different levels, mixed with other therapies. So sometimes you really need a trauma-informed type of therapy where some people have been through some things and they need extra care in how they're approached. And some people need straight normal OT practices that have to do with social emotional learning, be able to communicate directly. And this stuff has to be really intensive, and I imagine, I'm not an expert on this, but as they get older, it would be even more intensive and have a team that's really joined together to work with each individual about what they need. But I've seen children start to interact with each other who were very, very scared to work with each other, had a very hard time communicating, and have been able to be prompted and worked with slowly, often in a play-based environment, in a safe environment where they can play, where they can move their body. And I've seen them be able to approach other kids and start to use words with them, start to learn some of the social norms and expectations just by the prompting of therapists. This is all very intensive work, but I've seen a lot of strides. I've seen kids start to really be able to communicate and even have a sense of what is they're feeling. I think sometimes they need a lot of work to even understand what emotion they're having, what do they feel in their body. All of those kind of things can be helped by occupational therapy. So.
And Rachel, you were just talking about the, oh, there we go.
Yeah,
here I am. Okay, and so you were just telling me about how a social outburst may happen when somebody has like a physical ailment or something else. It doesn't necessarily have to be a
anger management issue.
Right, an anger management issue. It might be something internal that they just cannot express to say, hey, look, this is what's bothering me. Can you tell me a little bit more about that situation, how OT and PT have actually helped individuals with communicating their needs?
Well, so from the little I understand, as I'm just starting to get into this, I've seen situations where children aren't able to communicate what it is that's bothering them, and it could be even just textures of their clothes on their skin. It could be the way that something feels in their body. It could be some little irritant that to them is magnified. It feels really uncomfortable. We have no idea how uncomfortable they might be about some really seemingly insignificant thing to us. And so I've seen where therapists who have worked with someone for a while can point out, can see those things and go, oh, I noticed that he gets upset when this is happening, or I can pinpoint that thing and be like, oh, his clothes are tight, they're uncomfortable, the sounds are loud, the lights are bright. A lot of things can upset children, they can act out, and they don't know how else to, express their feelings, so they need other training about, how to express things. But some of it has to do with just little things that we don't even realize that can be really, really painful to them, just mentally or physically or emotionally painful. So I think there are a lot of people out there who know quite a bit about that's more than me, but I've definitely witnessed occupational therapists able to help pinpoint some of those things that are actually bothering those kids. So.
All right, guys, just a little bit more insight on autism and some of the opportunities that are out there, and gotta get this done. Gotta help more kids have more opportunities, more possibilities for their future. Take care.